Welcome. Today, I will be discussing COVID-19's impact on minority communities in the Los Angeles County. The CDC reports that there has been more than 60 million confirmed cases of COVID-19 globally and more than 1 million deaths linked to the virus. As it stands, the United States has become the latest epicenter for the coronavirus, with the country having the largest number of confirmed cases and deaths across the globe. Here in the Los Angeles County, we have had a surge in COVID-19 cases, bringing the total to more than 400,000 confirmed cases as reported by the county. Even more devastating news, the death count for COVID-related deaths in the LA County is close to 8,000. An alarming article written by the Los Angeles Times reports that residents living in high rates of poverty have almost 4 times the rate of death from COVID-19. For every 100,000 residents who live in areas with high poverty rates, an estimated 51 have died. In fact, death rates are worse for every other racial and ethnic group in the LA County compared to white residents. White residents were the least likely racial and ethnic group to die of COVID-19, with 15 fatalities per 100,000 Caucasian residents.
Today in the 1st District, there are hundreds of new cases, more than any other area of LA County. Just like Queens was the epicenter in New York, East LA and parts of Southeast LA and other low-income areas of the community are our epicenter. Brown and Black people bear a disproportionate burden of this crisis, from the health impacts to the economic consequences. It's important to recognize this reality and address it head-on. That's why we continue to open COVID-19 testing sites in areas facing disparities, for Southgate to Azusa to Boyle Heights. On Monday, we opened a testing site in Southgate and yesterday in Montebello.
Poverty results in people not having access to opportunities that contribute to optimal health. According to a report by the LA Times, if the coronavirus death rates for all groups were the same as it was for white residents, we would have 754 fewer deaths here in the LA County. Director of Health Services for LA County, Dr. Christina Galley, agrees that the disproportionate impact that COVID-19 has brought on minorities living in poverty is, quote, due to the long-standing structural and systematic racism that is apparent in many aspects of our society. As the number of COVID-19 cases continue to skyrocket in Los Angeles, the county is trying to take more drastic measures to try and flatten out the curve. A report by NBC claims that the LA Board of Supervisors approved plans to open more testing sites in under-resourced communities across the county.